Welcome to our channel. A luxury expedition cruise was supposed to be a once-in-a-lifetime journey across some of the most remote places on Earth. But instead, it became the center of a deadly health investigation. In May 2026, health authorities reported a cluster of severe respiratory illness linked to the MV Hantavirus cruise ship. Several passengers became seriously ill, and some lost their lives. The virus identified in confirmed cases was hantavirus, a rare type of hantavirus. Now the big question is this: is this the beginning of another global pandemic? Or is social media turning a serious but limited outbreak into a wave of fear? Let us understand the truth clearly. Hantavirus is not a new virus. It is a group of viruses usually carried by rodents such as rats and mice. Humans usually become infected when they come into contact with rodent urine, droppings, saliva, or contaminated dust. This can happen while cleaning old rooms, storage areas, farms, cabins, warehouse, or places where rodents have been active. The dangerous part is that early symptoms can look very normal. A person may first feel fever, tiredness, muscle pain, headache, dizziness, nausea, or stomach problems. But in severe cases, the illness can suddenly become serious. The patient may develop coughing, breathing difficulty, fluid in the lungs, low blood pressure, shock, or kidney-related complications. This is why doctors take hantavirus seriously. In the Americas, some hantavirus infections can cause a severe lung disease known as hantavirus cardiopulmonary syndrome. In serious cases, the death rate can be high. But that does not mean every exposure leads to death, and it does not mean the virus spreads like COVID. This is where many viral videos become misleading. Most hantaviruses do not spread easily from person to person. The hantavirus is unusual because it can rarely spread between people, but mainly through close and prolonged contact, such as household contact, intimate contact, caregiving, or shared enclosed spaces. So yes, this outbreak is serious. The cruise ship case raised concern because people from different countries were on board. Some passengers had already disembarked, and international contact tracing began. Health teams started monitoring exposed people, isolating patients, testing suspected cases, and investigating where the original exposure may have happened. That is exactly what public health systems are supposed to do during a rare outbreak. But no, based on current official information, it is not being treated as a global pandemic. But online, many claims started spreading faster than the virus itself. Some claimed the virus was already out of control. Some claimed a country already had a secret medicine. Some claimed this was a planned biological event. Some even claimed that lockdowns were coming immediately. At this point, these claims are not proven. And when it comes to public health, unverified claims can be dangerous. Fear makes people panic. Facts help people prepare. So what do we actually know? We know that the outbreak was linked to a cruise ship. We know that the identified virus was hantavirus. We know that hantavirus is rare but dangerous. We know that it can spread between people in limited situations. We know that health authorities are tracing contacts and monitoring exposed passengers. And we know that the general public risk has been assessed as low by WHO, while the risk is higher for people directly connected to the ship or close contacts. Now let us talk about safety. You do not need to panic, but you should stay alert. Avoid direct contact with rats, mice, and rodent-contaminated areas. Keep food sealed. Keep garbage covered. Seal holes and gaps where rodents may enter. Do not sweep dry rodent droppings because dust may become airborne. Use disinfectant, gloves, and proper cleaning methods. If you are cleaning old storage rooms, farms, basements, or abandoned places, wear protection. And most importantly, if you develop fever, severe tiredness, muscle pain, coughing, breathing difficulty, dizziness, or unusual weakness after possible rodent exposure, contact a doctor immediately. Early medical care can make a major difference. There is currently no simple home cure for hantavirus. Severe cases may need hospital care, oxygen support, intensive monitoring, or other supportive treatment. So the message is simple. Do not ignore symptoms. Do not spread panic. Do not believe every viral claim. And do not wait too long to seek medical help. The hantavirus cruise ship outbreak is a warning, not necessarily a pandemic warning, but a reminder that zoonotic diseases can appear suddenly when humans, travel, wildlife, and the environment collide. The world does not need panic. The world needs awareness, hygiene, quick reporting, and responsible information. As more official updates come, we will continue to explain them clearly. Until then, stay safe, stay calm, and stay informed. Thank you for watching.